and endow to lead the conversation about the community. So my boss, Tiffany Coleman, if you would like to that boss statement earlier, but I'll take it.
Good afternoon, you guys. Good afternoon. Again, my name is Tiffany Coleman. I'm a current school assistant for years. Many of you are well aware of what the employers are because you just left Teresa's journey there, right? Your energy's been flowing. I've subbed, so I know I've seen many of you in classes and we appreciate you. The whole purpose of the program is to get the community moving. Those who may not feel comfortable in a gym, may not want to be in that type of space, or just want a fellowship with people like that, and music that they like, sounds and tunes that really bring out our inner child. So we think it's vitally important that when we do these things, when we partner with entities such as the Petersburg Library, when we have support organizations like the Cameron Foundation, that we do our best to highlight that and spread that information as far as. So we appreciate you not only getting the workout on today with us, so y'all getting stronger and fitter, but also staying here to hear more about what we can do and what some of the needs are for the community in which we live in. The program itself has been around since 2014. We are truly a program of the community. As coordinators go through the program, we change and make modifications to make sure the program is stronger. But most importantly, we want to make sure that we're touching the community that needs us the most. The classes are free and as accessible as possible on bus lines and spaces that you guys feel comfortable with. So I know you are all here to hear more about what's going on in our area, but I want you to think about the friends and family members that may not come to class, and you might be the catalyst to change that. Okay? We are currently at 43 weekly classes, and that's across the enrichment, and there are several of them on Zoom, just like Teresa says, so that if you don't get them, we're there to support you. Okay, so I am honored, and every day I am humbled by the amazing work that I get to do supporting wonderful people like Teresa, Keisha Allen, Alicia Gordon, and some of our warriors from this area. We have a lot of great things coming. We know they do great work. So one of the biggest changes for our program is taking our volunteers to contractors and making sure that we're pouring into them financially, so that they know that we believe in the work. So we are thankful, again, Cameron Foundation, a number of the grants that we were able to secure, the Keenan Charitable Trust Fund, that really drove home our ability to put our money where our mouths are and support the community, starting with those that do. So again, I appreciate y'all. I love y'all, Teresa. It has been an honor working with you, under you, learning from you, all of the things. Valerie, different. So if you don't know what that is, they represent the third class. Third class. That means they came through in 2016. They've been doing the work in these communities for a long time. And to put that into reference, we will have applications launched for our 12th class of Fitness Warriors this October. So we are looking to get more people in seats or in classes on their feet, strength training, whatever works best. We really want to be the catalyst to change the health narrative for our community. So again, thank y'all so much, Valerie. Thank you for all the amazing work you're doing right here. To give us information we need to make it better. So I'm gonna stop talking because you know we have to talk a lot. I love y'all.
Is the organization actually that really helped me start doing anything that I've ever done in this community. It was through PWC that I actually wound up hearing about Fitness Warriors, Cameron Foundation, all that stuff. The current chair is Monique Lindsay Howell. Monique, you want to say hi real quick? You got to come to the front. But there's so much great stuff going on.
Hi, hello everyone. My name is Monique Howell. First, I just want to say happy anniversary. just the chair for a year. I am still growing, however, she's still past chair. But our desire is to connect the community to resources, to make sure and to also hear from the community of the resources that are needed, so that we can also be connect to a lot of connectors to help people be able to get the things they need from health and wellness. Also, but I just wanted to say that we are excited to partner today and happy about what we're going to learn from also Valerie, and she's also part of the church. She's also a member of Petersburg Wellness Association. And so we just thank you all for, you know, being a part of all of this. It's truly amazing. And comment about her, and not for all the work that she's done in our community through our organization as well as through. So thank you, thank you, thank you, thank you.
Now it's yes. Good afternoon, everyone. Oh, you're long.
My name is Valerie, and we're going to hear a little bit about our Holistic Foundation. In addition to reviewing grants, we focus on I focus on. As I said, we'll get into different pieces of what we do at the foundation individually to kind of introduce you overall to what we do. But I do want to do a disclaimer because my car didn't start just before I came over here. So the tow truck driver has called me one time. He may call me when we get to the parking lot of the foundation. That's the blessing, is stopping at the parking lot of the foundation, so we don't have to try to figure it out. So I'm gonna tell you right now, stretch break. So you get this warriors, y'all just stand up, stretch, whatever you have to do, and I will be right back. So I'm not trying to be rude. I just want to make sure you take my call. All right. All right. So at the Cameron Foundation, we were established in April 2003, and we were established as a result of the sale of a community hospital. When a hospital is sold, and it was the Southside Regional Medical Center. When it's sold to a for-profit entity, that hospital is sold to a for-profit hospital, then those funds have to be used for the benefit. And that's how we got started. The board of the Southside Regional Medical Center decided that they wanted to use those funds and start a foundation. We are a private 501c3 foundation. We're considered a health legacy foundation. And we are a health legacy foundation because we were started as a result of the sale of the hospital. Our funds are directed into three main areas. Responsive, that's when we have 2 grant cycles in which nonprofits can apply to us for funds.
That's a January LOI and a June decision, a May LOI and an October decision. We also have a bucket of funds that's called Proactive. And those are funds that we strategically place into projects, programs, initiatives that we hope will make a strategic impact in our communities. And we also direct funds into what we call capacity building. At the foundation, if you go to our website, we sometimes host nonprofit management classes where you can come take classes. I think it's $25, at least it used to be, but you can actually earn a nonprofit certificate by taking those classes after taking so many classes. We also partner with the Center for Nonprofit Excellence, and the Center of Nonprofit Excellence, they provide webinars and education opportunities, even have a circle for leaders of color and circles for leaders who are trying to make strategic impacts in their organization. And then our newest one is called Catch a Fire. And this is our newest strategy where we provide nonprofits with consultants that will help them to implement some of the things that they would like to happen in their organizations. For instance, if you want to do a strategic plan, if you want to do a fund development plan, if you just want to do some more training, you have an opportunity to use Catch a Fire. The consultants are all across the country, and they will work with you. They'll agree to send them a proposal, they'll agree to work with you, and then they will work on the areas that are most important to you. So those are the 3 buckets of funds that replace our funds. We are called or considered a place-based funder, and as a place-based funder, we serve the cities of Petersburg, Colonial Heights, Hopewell, and the counties of Dinwiddie, Prince George, and Sussex, and the southern portion of Chesterfield. We serve those communities because it is estimated that those are the same communities that the hospital serve. And that's how we came to that piece. I'm not going to read our vision, but roughly saying we hope that we improve the quality of life for the residents in our service area. And our mission is to do that by investing in our nonprofits and some of the other strategic partners and stakeholders that we have to influence community impact. We have 6 areas that we provide represent. Healthcare and human services, that is that focus that I have in terms of what I do at the foundation. We also fund in community and economic development, education, historic preservation and conservation. And under that, we even have a bucket of funds that are designated for sacred landmark grants. And those grants are designated for historic churches that want to make improvements in their buildings. And then we also provide support for arts and culture. These are the outcomes that we hope to achieve in our service area, and our goal is for our mission to support those outcomes that we see listed here in terms of hoping that we have dynamic nonprofits, vital economy, vibrant communities, education excellence, cultural richness, and healthy residents. So we hope our mission helps to support those outcomes. And now that leads us to what we're going to talk about today, our community indicators. I wasn't sure how many people would be here. So the folders that you had, I think everybody has one. I don't think you should have. So they may have a little different organizational information, but they essentially have the same thing. We're going to talk about how to access the health needs assessment. It's a pretty lengthy document, but there are 2 things that you see on our website when you go to www.canfam.org. If you go to the publication, if you go to About Us tab under publication, you'll be able to access the community health needs assessment. The community health needs assessment, we have been doing updates to those since 2004. In 2018, we kind of changed our focus a little bit in terms of not just access to care, but talking about the social determinants of health. So in our 2018 health needs assessment, our lens shifted to social determinants of health, and in 2023, we continue that. The social determinants of health, in a nutshell, is saying that while access to care is vitally important, and it is, being able to go to the doctor, being able to access the necessary vaccinations, medical treatments that are needed, being able to just really take care of your physical being. There are other things that determine our health as well. And those other things that determine our health as well is education, is ability to have clean water, clean air, is the ability to be able to earn a decent income so that you can provide for your needs around food. So, that's one of the determinants of health, which I'll show that model in a minute. Talks about all of those pieces of that. And so that's the lens that we have for the 2018 and 2023 health needs assessment. But also every year, if you don't want to read that book, is we have an update to our service area report card. And this is a quick snapshot where you can look at a number of indicators, and then on the far side there, you'll see the red, green, and yellow. And the red indicates whether we are doing worse in that area, if we're doing about the same, yellow, or if we're doing better. So that's a quick way of looking at a snapshot of our service area in terms of how we're doing in terms of that. In your folders, you will see things like the executive summary that's in your folder for the 2023 health needs assessment, community snapshots, and I'll explain that in a few minutes. Survey recommendations that we pulled from 2018, I'll explain why with that. But also what is different between the 2023 and the 2021 way that we track indicators is in the 2023 document, we include community voice. So the snapshot is where we actually pull a focus group of citizens from each of our localities, and we ask them questions about the health of the community and the things that they see from their lens. The survey, we do that maybe every other year. We did a survey in this one. The surveys are when we push out to the community and we ask you to respond to different questions around health. Also, what's different in 2023 is we also looked at things from an asset point. In other words, we didn't just focus on what was wrong. We asked people what do we have a bunch of communities as well. So we did that combination in addition. In the community health needs assessment, we have 8 chapters: demographics, health behaviors, health outcomes, social determinants of health is a section by itself, community snapshots and focus groups, survey results, and then we have appendices, which really talks about our methodology and kind of really want to dive deep into the data, kind of give you an indicator about that, and also life expectancy next. So let's talk. I'm just going to really hit quick highlights about what's in the document. And I'm going to treat this just from the perspective of our region, but you'll also see some things that I think are kind of interesting. When we look at the demographics in terms of who lives in our area, when you look at the percentages, you will see that in terms of racial composition, Petersburg and Sussex are dominantly black. I was speaking to the choir in terms of who lives in what community. Colonial Heights, Denby, and Prince George are predominantly white. Hopewell is closer to a 50-50 split, with a little bit more white citizens living in Hopewell than black, but they're pretty much close 50-50%. Southern Chesterfield is not captured here. We captured more of Southern Chesterfield in the last update in 2018. We could not really pull it out like we wanted to in this document, so we did not include Chesterfield. And the reason why we didn't is because when you look at Chesterfield as a whole, and you'll see in a few minutes, their health outcomes, they do fairly well. But that Southern Chesterfield corridor does not. And so what would happen is if you folded it all in together, you would think no one needed resources. But that Southern Chesterfield corridor, which is like Ettrick, we told them, the Route 1 corridor, the old Jefferson Davis Highway, parts of that Harrogate Road, parts of the back part of like Woods Edge, all of that, you will see different pieces where you know more resources are needed. And so we didn't want to have that skew. Also, the demographics, when we look at the Hispanic population, Colonial Heights, Hopewell, and Prince George have the highest Hispanic population in our service area. Petersburg population has steadily grown. When I compared it over the last time that we hosted the health needs assessment, the Petersburg population with Hispanic members have grown as well. And so you see that as a rising population. When we look at the population by age group, Colonial Heights, Dinwiddie, Petersburg, Sussex have the highest aging population of 65 and older. Hopewell actually has the highest percentage under the age of 82. And so while I'm not going to discuss one thing that is not on here, but one thing that Hopewell is, so you'll realize if you look at health needs assessment how some things track. So Hopewell has the highest percentage under 18, and they also have the highest number of preschool kids, the highest number of kids who attend preschool. They were actually higher than the state average. And so when you look at the fact that they have that growing population, you can probably estimate that they have a large number of growing families in that community. Whereas with Colonial Heights, Petersburg, and Sussex, you have a higher aging population. But we also anecdotally talk about in our office, where are all the services for your older population? Scattered. So again, it lets us see what some of the gaps are. So when we look at the demographics that is living in our service area, health behaviors lead to health outcomes. And so when you think about physical activity, Hopewell and Petersburg have the highest percentage of adults with no leisure time or physical activity. And so when you break that down, it's saying that over between 2004 and 2019, you will see that has not really made, it has no leisure time or physical activity, has grown even over that period of years. Even with a lot of the things that we put in place, it tells you that's great, but there's still more that we can do in terms of how to encourage that. Exercise and physical activity, as we know, has been shown to be a key factor in good health. So that is something that we really need to pay attention. Now, when you look at tobacco use, remember, we have some areas where we have limited physical activity. Tobacco use is high across all our localities, above the state percentage. It's highest in Petersburg, Sussex, and Hopewell. Now, what you'll see in 3 minutes is that Petersburg, Hopewell, and Sussex in our service area is the lowest in health factors and health outcomes. And I'll explain that in a few minutes. So when we talk about the communities where we direct resources and think about where we need to really think about how to engage, it's again, low physical activity, high tobacco use. Excessive drinking, this one was interesting. Hopewell, Petersburg, and Sussex have the lowest state percentage. Prince George, Dinwiddie have the highest. And when you think about it, Prince George and Dinwiddie, I didn't say this, but Prince George and Dinwiddie are more rural. Sussex is rural too, but more rural in those localities. And so when you think about, again, drinking, tobacco use, all of those are indicators in terms of things that impact health. When we look at health behaviors around drug overdose, all of our localities, except Prince George, was higher than the state rate in terms of drug overdose. Hopewell and Petersburg had the highest rate of drug overdose. And Sussex, there was not enough data to really classify. And so if we kind of capture what we just heard about, physical activity, tobacco use, excessive drinking, overdose, this is the Robert Wood Johnson County Health Ranking Health Factors. And so with this is a foundation that focuses, a national foundation that focuses just on health. Every year, they rank from 1 to like 133, where counties fall in terms of health. 1 being the highest, 133 being the lowest. But when you look at our service area, and you look at where we fall, again, remember I told you how we still can skew how we look as a community, they're at 18. So they're at the higher end. When you look at Hopewell and Petersburg, they're at the bottom end. They're 131 and 133. Remember the rankings are from 1 to 133. And then the others fall in between. And Sussex is at 124. And then we're going to talk a lot about what we look at as far as those health factors. But again, health factors, health behaviors lead to health outcomes. So lower physical activity, tobacco use, excessive drinking, drug overdose, those lead to the health outcomes that we may see. Let's talk about health outcomes, okay? Because again, all of those things lead to outcomes. When we look at high blood pressure, all of the columns in our localities are higher than the state average, except for Colonial Heights and Prince George, under the less than 65 years of age. So high blood pressure is an issue in all of our service areas, less than 65, except for Colonial Heights and Prince George. When we look at obesity, all the genders in our service area are higher than the state, except for Dinwiddie. Again, thinking about physical inactivity, tobacco use, excessive drinking, a lot of things that will lead to obesity. So that's looking at that. Diabetes, the other chronic disease. Colonial Heights is the same as the state, 8.7, 8.7, but everybody else is above the state average. So again, chronic disease, high blood pressure, diabetes, that's a problem across our service area. And then finally, mortality, heart disease mortality. This is a 5-year average rate per 100,000. The state rate is 76.5. And then you can see there, with the exception of Prince George, everybody else is above the state rate when it comes to heart disease mortality, those who have passed away. Again, thinking about health outcomes, physical inactivity, tobacco use, excessive drinking, high blood pressure, diabetes, which can lead to obesity, or vice versa, depending on how it is. But again, all of these things, the outcome can lead to mortality. So we look at the Robert Wood Johnson, because you have Robert Wood Johnson health factors and Robert Wood Johnson health outcomes. Again, looking at the outcomes, where our population end up in our communities. Again, you will see Hopewell, Petersburg, and Sussex are at the bottom end, Chesterfield, and Prince George are at the top end. And then the rest kind of fall on them. So then that's the picture of what our communities look like. And this is the county health rankings model. And so when you talk about health factors and health outcomes and look at that model, policies and programs impact our health factors. Health factors impact our health outcomes. So we're going to talk about how sometimes those policies and programs and those things that are in place don't contribute to a healthy community as well. And then when we look at those things that contribute to our health, as you can see here, health behaviors is 30%, clinical care, which is going to the doctor, seeing the nurse, is about 20%, that's 50%. But those economic factors, education, employment, income, family support, community safety, that's 45%. 40, yeah. But that's a big bulk of that contributes to your health. And then your physical environment, when we talk about your air quality, your housing and those kind of things. So this is the rankings model. This is the things that they look at in terms of what impacts our health. And then of course, we're looking at the life and quality of life. Yes, ma'am.
Just a question, considering all those determining factors, are you considering gun violence in any of your?
It came out a lot. When we did the focus groups, that came out a lot. And there is a I didn't put it up here, but it is a piece in there about violence, yeah. But it came up definitely in our focus groups in terms of what that looks like and how it impacts safety. Gun violence, well, I'm just gonna say violence in general, but think about how safe the neighborhoods are. When people talk about physical inactivity, how safe is it to walk? You know, is your neighborhoods walkable? That leads us to policies and programs. What can make our communities more walkable and safer for people who take advantage of what's available? So that's where the policies, you know, so that did come in business groups. So when we talk about health outcomes, let's switch a little bit and look at our youth, because that was just a really quick, high overview of our communities. And so when we look at our youth, when we look at the teen birth rate, all of our localities except Prince George are higher than the state rate in terms of teen birth rate. And that's up to, I believe it's up to the age of 19 when we look at that birth rate. Okay. When we break out across race, we see that Hispanic youth are surpassing the state rate where data is available. So in many instances, they're surpassing, that racial demographic is surpassing. You also have white youth in all localities except Prince George that are higher than the state rate, and also Black youth, all except Prince George and Dinwiddie. So do you hear the continuing theme in terms of the health of our community? A lot of the cases where we surpass the state rate, often when you look at Prince George and you look at it just across, they don't surpass the state rate. Their community overall is pretty healthy, and again, we'll drill down to why. I do want to bring out too, and we talked about this with the teen birth rate, and particularly in Petersburg. Petersburg has one of the highest teen birth rates at 64.7% per 1,000. But I always like to point out, because people say, you know, well, what are we going to do? A lot of things have been done. A lot of initiatives have been put in place. When I first came to the foundation, I think that rate was like 160. When I did pull the data from the 2013 Health Needs Assessment, that state rate was 138.7. It's now 64.7. There is movement, but sometimes it doesn't feel like it because the headline is you're still the highest. But the other part of it is there has been movement in changing that. And the state average at that time is 42.7. So there has, with a lot of the initiatives, education, contraceptives, different contraceptions that have been made available, that rate has started to respond. I do say though, after, the pandemic, we'll see what happens with the next round, but, you know, it has definitely made some changes. So again, looking at the youth, on-time graduation rates, Colonial Heights has the highest percentage of on-time graduation rates. Prince George is the second highest, followed by Dinwiddie. Dinwiddie is slightly below the state average. And we'll talk about why bringing that up is really important. So they have high on-time graduation rates. But then there's a indicator that's called disconnected youth. And when you look at disconnected youth, that is youth that are not involved in educational opportunities, and that's also youth who are not involved in work opportunities as well. They're not really going to school and they're not working. Colonial Heights has the lowest disconnected youth percentage. And Prince George again has the second lowest. Again, that tracks with that on-time graduation rate, where Colonial Heights was the highest on time, and Prince George was the second. Petersburg and Sussex have the highest disconnected youth. And then when we went back, if you go back to the graduation rates, Petersburg has one of the lower graduation rates. Okay, again, data, I always like to say data tells a story. So remember we had that thing that talked about policies and programs. So let's look at school funding adequacy. When we look at school funding adequacy refers to the lowest gap in school funding versus what the need is. So that means it's what you get versus what you need for that particular population. Colonial Heights has the lowest school funding gap, school funding adequacy gap. They are still above the state average, minus 212, state is 186. That means that per pupil, they're missing about $212. And then that is also followed by Prince George. They are about $976. The school funding gap for Petersburg is $13,160. So when you think about, again, disconnected youth, teen birth rates, how policy and programs drive some of the decisions that are made, it's hard to have, again, we talked about it in the very beginning, where we put our resources. If you don't have the resources to put in, you sometimes get certain things that happen when those resources don't go in. And so that gap is huge for Petersburg, and the second highest gap is Hopewell in the south. And going back to what I said before, in terms of health factors and health outcomes, those are the three communities that are the lowest in health outcomes. But they're also the three communities, in addition to teen birth rate, in addition to graduation rate, disconnected, they also have the lowest, they're also the lowest resource schooling. So looking at the snapshot, you have the snapshots in your folders, but this is just a quick view of the Petersburg community snapshot. And so the violent crime rate, someone just asked about that, I didn't put on this, in Petersburg is 829.5. In Virginia, it's 207.8. So that rate is almost triple. We're really fortunate. Yeah. And we talked about the mortality rates. Also looking at the housing cost burden. Petersburg citizens pay more for housing than the state average, and they pay more for childcare on state average. The median income for someone in Petersburg is about $43,000. The state average is about 76. There's limited access to healthy food, and 34% of the children live in households with income below 100% of the poverty. And so when we think about the social determinants of health, and I always like to say, and I'm not gonna play that news story, but there's a link right here. You go WTDR TV6, and they talk about underfunding public schools and what that compared to other states. And they did a JLOC report, a report that focused on why our formulas, a lot of our formulas are old in terms of health, mental health, and school funding. But funding schools is based on staffing and not based on students. And so when you think about the existing formula, which is outdated, which is based on the number of staff needed as opposed to the number of students and what their needs are, then the schools are continually underfunded in some areas, and more so in those areas where there's more need. So, a lot of times people like to say Pittsburgh is the poster child or the problem child of the region. And I always say it's the poster child for when a system is broken. If the system is not broken, if you work on fixing the system, then you work on fixing the problems, not putting a Band-Aid on, but really looking at what's gonna make that change. And so the median household income, poverty is the strongest indicator of poor health. All localities, median household income is below the state average in our service area. But again, Prince George is the closest to the threshold, followed by Dinwiddie and Columbus. So when you think about poverty as a single indicator, and then you look at the median incomes across the board, then you can see, again, going back to the snapshot, if you look at Petersburg and Hopewell is the same way too. You're spending more on housing, you're spending more on childcare, you're spending more on food, and so a lot of your income goes to that, at least most. In life expectancy maps, this is our whole region. The red are for those who live, who don't live as long, to the blue, which lives, have a longer lifespan. When we talk about seniors and where that falls, you can see in our service area, the blue is right in the middle, and that's parts of Prince George, and it looks like parts of a little bit part of Hopewell, probably is closer to the line, Colonial House and stuff. But yeah, so that's where you would see the blue. Everywhere else is going to be red, orange, yellow. When you think about life expectancy in our service area. We did conduct a survey. We do not usually conduct a survey every year, but we did this year, and 3 things came to the top in terms of the top health issues in our region. Addiction, mental health, and aging issues were the top 3. And some of the discussion points in terms of what we asked people in those surveys, we asked them what were the resources in their communities, what were the barriers. Again, we did this survey asking them to talk about the assets. And so a lot of things around assets were about the environment, having nice parks. For some localities, the river, certain organizations like sports backers, and other nonprofits that interact with communities. But we also actually talk about current services and service gaps. And the question that we always ask is, or we ask internally and externally, is who's most affected by the issues? And are they actively involved in finding the problem and taking the solution? And a lot of times that's not the case. Most times it's not the case. And so those are some discussion points that we had in the particular session. When we talked about the reason why our recommendation is 2018, and I like to add this, as I said, we did the 2018 health needs assessment. And in the document, we have a list of recommendations. I did not ask them to do recommendations for our 2023 document because, quite frankly, we didn't do enough, I think, as an organization to really focus on the 2018. And so what I ask is that we bring this back forward and really think about strategically those things in 2018 that we can do to look at what we're going to prioritize as a foundation to really address what we can, because one entity can't do it all, but what can we address in partnership with other people to really look at what needs to happen to make impacts in our communities. And so I'm not going to read each book, but we often convene partners, and even convenings like this where you bring awareness and you have conversation and you pass the information along, that's a great start. I think when we talk about the third bullet from the bottom, how we look at systems, policies, and environmental changes, that's a harder one, but that's the one that's really going to drive the change that's needed. And that really, really needs community voice. And community voice is important when you look at policy systems and environmental changes. Which brings me to the comment about civic engagement. when you think about how you want your voice heard, a lot of times we do focus on our national elections more, but we have state and we have local elections where you can really just lift up what's important to you as a community. But you do have to have a united community voice, because we do know we're gonna have people over here saying this, people over there saying that. But you know, you have to think about what's important as a community. And so when you think about civic engagement, these are things to think about when you take information back to your groups. Is that every seat in the General Assembly this year is up for election. And every seat is 40 Senate seats and I think 100 House of Delegates. So that means wherever your representative is, it gives them, whoever your representative is, this is the opportunity for them to hear us. This is the opportunity for them to hear and listen to what we have to say. It is also estimated that in addition to that turnover, that there will also be a natural turnover because of retirements. People who are just saying, I've worked, I've done what I've done, and I'm tired, and I'm moving on. So they estimate that's about 30%. And then there was also redistricting. That means that representatives that you may have had before may not be the representatives that you have now because of redistricting. So even pay attention to who is your representative at this point. In terms of advocacy information, when you're educating your communities, you have the Virginia Department of Elections. If you go to their home site, you can get tons of information there. VPAP.org is a great information for getting what I say nonpartisan information. They just talk about issues, they give you the information, and then you can make the decision for yourself. You also have the Virginia Interfaith Center, which will host information sessions about different issues. And pretty much any advocacy organization has a bill tracker on their website. Now, I think the General Assembly has made decisions about the budget. But for instance, if you can voices from Virginia Children, and then there's a Virginia Alliance for Housing, they usually have bill trackers on their website. That means whatever is important to that organization around housing, around issues for kids, around health, if it's an advocacy organization, you can track that issue and again, decide for yourself what's important. For the community health needs assessment, again, you can access the whole document. If you go to our landing page, you can go to the buttons over there and you can download the whole document. If you don't want the whole document, which is understandable, you can go to About Us under publication. And when you click on the 2023 Health Needs Assessment, you can download the section that you want. So if you just want the snapshot, you just get the snapshot for where the community you live in. If you just want Petersburg or Dinwiddie or Prince George, you can download that snapshot. If you just want to see the survey results, you can just pull that survey results. So you don't have to download the whole document, you just download what you like. We also have a feedback opportunity, and we started this year, this quarter here. And we're asking people that if you use the document in your work, if it was useful to you, please let us know. Because every year, we do this every 4 or 5 years. And we always struggle with whether or not we should do updates to it because it's very labor intensive. But you know, sometimes hearing from communities about how it was useful, because every year we look at what we can change and hopefully what we can do better. And so any feedback is appreciated. And for the snapshot for Sussex, this was the first year that we were able to convene a focus group of all Hispanic residents, and they were in this room. And so the consultant that we worked with, Institute for Public Health Innovation, they collaborated with La Casa de Salud, and they actually had community health workers who shadowed some of our facilitators, and they conducted the session in their language with that community, and all of them were Petersburg residents. And so we were able to hear from their viewpoint, the things that were, you know, as people sometimes live under the radar. So we were very happy to be able to do that. And I'm sure there are communities like that in every community in our service area where we were able to do that for the city of Petersburg. And so that also, but you'll have to go to the Sussex snapshot, and it's right after that. So the next steps for us as a foundation, is having conversations like this and building awareness about what's in the document. So you can take it back and have discussions among your communities. And we're gonna do website input. We also have an annual meeting, that's in October, and at that annual meeting, we also have a guest speaker, Dr. Stephen Wolf. And he really breaks down data and talk about how it impacts community and really give us a strategic idea of different plans that we should have. But also at that annual meeting, we will have a panel from not Petersburg, but a certain area, and they will talk about how they have used data and that work to do some of the initiatives that they have at their organization. And then we, as an organization, have a strategic planning process that we hope will help us to not only inform our work as a whole, but help us to drive what our priorities need to be. And then we're going to look at a community health improvement plan from a funder's perspective. Again, trying to be really strategic about how we align our dollars. This is our staff. Lady Marsh Carter is the president of our foundation. She just started in January. And then that's the rest of us. I focus on community health, value livings. Risha focuses on arts and culture, and she helps with, she does communications, our website, and all of the information that comes out into the community. Brandy focuses on community and economic development. Jerry is education and workforce, and Michelle is our grants manager. So that's how we divide out the 6 program areas in our focus. We all review across program areas, just because sometimes there are so many that may come in one program versus the other. But in terms of initiatives, those are the things. And that's it. So, any questions or comments?
So, one of the things that, of course, really struck me was aging issues.
Yes.
And I remember when you did the presentation for us, you were, you talked about how challenging it has been. It gives, those of who are more seasoned, whatever, to interact, engage in these kinds of ways. So, that was one of the reasons why I wanted you to talk to this group, because everybody here has in some way been really active in the community and in their churches. I know Lois talked quite a bit because, your church is incredibly active in the community, and I know many others. So this is. So I would just like to hear more about so what is meant by that? What do you?
Well, in terms of when we talk about Asian initiatives, there's a lot in philanthropy talking about age wave. So it's not just our influence. It's the fact that we are learning as people of a particular age, and I think I fall into that too. That are learning how seniors who have learned how to take better care of themselves. And we go to Dr. Moore. I know I look physical regular. I listen to what the doctor says. But I also try to get active. I always tell people that I think about physical activity as a prescription. Sometimes I just don't feel like doing it, but it's like, okay, I haven't been, this week, I need to get up. So, I treat it like a prescription, But one of the things, I go to the Y in the morning. And one of the things I notice is you have the Y, which has a strong group. You have sports backers that have a strong group. And the triads. I do see the triad that has a lot of activities for seniors. And candidly, I said, I don't see a lot with Prager area on aging. And that would be one of the organizations that we would partner with to think about strategically, what are some programs, what are some things we can do with seniors, because that is the identified agency around aging and thinking about how we can provide more programming. But right now, I mostly see the triad, the Y, and sports back. And even with that, I know you don't particularly do aging across the board, but in terms of just that, and so that's one of the things in one of the round tables we ended up talking about, who does this. And we say Prager area agency of aging because they are across our service area, much like Prager Health and District 19, they serve 9 localities. And so when you talk about impact, you want to align with those individuals that serve across the whole locality. So that was that conversation. But we do definitely, with programs like this, we do see a lot more activity. And even, I can say with, the beautiful thing about the fitness warriors, you know, I've even seen them teach classes for a while. So you can see collaborative partnerships cutting across when you talk about people in communities that are trying to make a difference. But it's constantly looking for partners like that, who we can align and make investments with, and think about how we can drive it. Yes.
I've asked a lot of times about a senior group. And we used to have one and it just dissolved, like a senior group. We used to go out to meals once a month and then the actual, when it was outside, they had been the second time for the talk. We usually had the doctors talk about something and tell us.
And then, and honestly, that's why I see the triad wildly for that. But it used to be, I know what you're talking about, it did used to be more of that. I came to the foundation in 2008. So between that 2008, 2012, you saw more of that.
Yeah.
And then you saw less of it as time goes on.
Well, COVID killed that group. Yeah, so.
Oh, yes.
I just,
I just have a question, I am very new to Pittsburgh, and, when I moved here, it was during the pandemic, so I was able to get to meet everybody, and thank you for the, New Orleans, here I am able to participate in people in my age group, and my peers. But I was just a little bit taken aback when I found there were really not a lot of opportunities for somebody, you know, for me and people in my peer group, my age group. There is nothing available on a daily basis where seniors can go, they can meet, especially as this lady back here, has spoke up. Especially when, you know, you have all your data, you have all your studies, but I didn't see anything in there that referred to the fact that the United States Health has put out a study and it says that the number one thing for us seniors that is now pandemic is loneliness.
social isolation.
Yeah, there's so many people who lost partners, and you know, their lives are just turned upside down. There are people that they just need that. They need to have someplace to go. You can, you know, you can play cards, you can listen to music, you can talk about old school stuff. Once a month, we're gonna do this. There should be something available on a daily basis, 5 days a week, where you can go maybe between the hours of 9 and 4 or 5 or whatever, and socialize with people in your peer group. So my question is there anything that the Cameron Foundation could do to support that idea? If one were to put together.
And that would be the piece. Definitely, the easy answer is yes, there would be something to support. The issue is what organization is taking it.
Okay, it doesn't have to be an organization, could it be a person or two?
For us to do. Because we fund 501c3.
It has to,
It has to be an organization. And that's why I mentioned, we've seen less organizations in that space.
yeah.
But if there's an organization that says we wanna look at community centers, and we wanna do that model.
Yeah.
Because I see that, you know, that's a lot,
Yeah.
without being rich, but you're exactly right, and I think that's how that discussion happened, at one of the meetings that we hosted, because there's not a lot of that.
No, there isn't, and so what about, is there a department per se, such as a department on age before Peters got hurt?
That would be creative area.
Is that on age, or is that just for health? Right. For age, thank you so much. I appreciate it, thank you.
Yes, ma'am.
So I just had a question to that. So I know Teresa was talking about how some of the members were connected to other churches or organizations that way. Do you all fund like projects that churches may?
So the churches, as long as it's not for, religious purpose. So a lot of churches have, I forgot what the term is, but a lot of churches do have a separate entity that you can provide funding to. That's, I forgot what it's
Like
called.
an education fund or?
Education, they call it something, a CDC.
Okay.
It's like a community development corporation. So some churches have a CDC. And if they have a CDC, we have provided grants to that CDC. But not to the church itself, because we can't espouse a particular belief. But if the church has a CDC, then we can provide it.
So that's the only way we're gonna get something going is to work through a church that has a 501c.
You do have agents, you have pretty area on age.
They're not active though.
Yeah.
Yes, ma'am.
Yes, just to piggyback on the conversation from everyone, what about, okay, let's say I live in Dinwiddie, and so I go to Petersburg for all my shopping, because it's out of the floor. And so there's nothing down there, and it's a lot of people my age, a lot of senior citizens, baby boomers down in Dinwiddie, but they all seem like they're in their own world, and it's the few that run into the post office or something down that way. But when I go here to just to get into any type of activity, but I think a lot of it is transportation, or is it people, because if I mention this, I might meet somebody at the post office, right? It's a kind of reach the area. So I sent another older person my age. So once you go to Petersburg and do the, cheer dance, but I do, they go, I don't have a way to get there, I mean, I could take you or whatever, but then they have all these other issues. Sometimes they just want to stay to themselves, or if they do want to get out, this transportation is non-existent, especially in the rural area. So I was wondering about, is this, I mean, they don't take this to a whole nother level, but it's sort of transportation factors into this for a lot of applications.
And so we can find transportation has been listed as one of the biggest barriers for ever since I've been here.
Or even have something in the community, like the community center down and stuff, didn't really.
So in Dinwiddie, they got the enhanced, if they got them on different ends, I can't remember all the
There's the
names.
East End Enhancement Center and then the McKinney Center, which is further into Dinwiddie.
So with Dinwiddie, it's really getting with that rec and parks person to say, we want these activities here at the center. Because Dinwiddie has a nice, they have a nice, two nice centers. Yeah, they really, and one of them, I think, even had exercise equipment in there. Used to
He said, the full gym, cost $1.
Yeah. But again, this takes us to that point though. People don't know about it.
Right, that's true
A
too.
lot of people don't know because, and, yeah, a lot of people don't know.
I think we get the word out to people, especially that is the Petersburg area, where it's so, condensed, but when you get out to the rural areas and stuff.
And I think that was a challenge because we had one folks when they said that was their challenge, one government official said. It was that said, that was their challenge, because they said, they'll send out mailers or they'll put things in the utility bill, but people just don't read it or don't respond to it. So then it makes no interest. But people are interested, they just didn't key into that information. But that was one thing that he talked about a lot, was the fact that, they have a hard time getting information out in a consistent way where people will read it and look at it and see it.
Petersburg Parks and Leisure has partnership with Tabernacle Community, and they have activities every day from Monday through Thursday. You just have to have a letter from a physician that is able to participate, and they also have bus trips to different parts of the state.
Nice.
Is
And so again, being able to get that information out. Yeah. Yeah. So did everybody hear that about Tabernacle?
Shaded, and I'm going to say, I go to, Colonia Heights singing, yeah, Monday through Friday, they got trips and they got activities Monday through Friday, yeah. The 8:30.
Somebody said they offer transportation.
No, you have to live in Colonia Heights.
So live in Colonial Heights is giving you transportation, but you can attend even if you're not.
I attended everything that I was going to.
So that's one thing that, again, ideas are, but it does sound like, that one thing you can do as a foundation too, is see if all the providers of senior services are willing to come in one room and talk about it. And then talk about what, because it seems like it's different scattered pieces that's topic.
Yeah, just the person resident program, a lot of them, you have to, you sign up and go online and, you know, you have to. Well, and this is just my opinion, I signed up for a class when I was in their system, and I'm younger, their system is not user friendly at all. But in this area, I mean, I drive, but like, I had a stroke, I couldn't, well, I probably shouldn't be driving. That's not the point is my peripheral is not the best, and there is no transportation, and
Yeah, they don't have.
my mother was the one, and my kids who drove me around, but just even trying to go to Walmart, like, it was frustrating, because I went from doing all the things to none of the things. So it was frustrating just to figure out, like, oh, you really cannot get around here if you don't have a working vehicle.
Yeah. That's a huge problem.
It is a big problem. That's why, no, we're not gonna. Yeah.
Tabernacle offers transportation.
To everyone, like everywhere. Which is.
For their program, and do you have to be a Petersburg resident?
And do you have to be a church?
You have to be a Petersburg.
You have to be a member of the church.
No. You have to be registered for Parks and Leisure and is a Petersburg resident for that particular program. But Valerie, it sounds like we have kind of a project. If we should. Yeah.
Because I think what they said in Emily is true, that it's hard to get the information out. And when you have all of the different pieces there, and like you said, you were new to the area, still trying to figure. And it's also comfort level, it's also comfort level and how you feel going in different communities. So, yeah, we do have a project. Thank you very much.
Once again, thank you so much, Valerie, for being here. Thank you, Tiffany, for making sure some of our other folks can still participate. Thank you all for coming. We are going to have another conversation that's moving also about the improvement plan stuff on September 28th. It'll either be here or in the event center. I think it might be in the event center next door. Valerie is willing to take this show on the road and have more conversations in your church, your community center, your family reunion. I don't know. Get in touch with her. Her information is in there so that we can have these conversations and come up with things like today. We generated an idea for something that we may be able to do to help move life forward better for everybody. Does that make sense?
Yeah.
Thank you very much. Oh, yes, I will. And on the table on the back there are just some additional items. We in the Critter Health District, we want to make sure we say this is Emergency Preparedness Month. I've shared some of this information before, but we've got other stuff. Please take one till it's all gone. We do have a couple extra meals here. So we can grab it on the way out. Any final thoughts? Anybody want to share anything? Any final thoughts? Okay. I will see you next Thursday, and then we'll come up with some of the fun stuff for next week. Thank you. Thank you, our folks online. Thank you.
It's like I know what.
Thank y'all for joining in. We appreciate you taking part in the information. I will make sure that once this is saved and we upload it to YouTube, that we share the link out with everyone that was registered for class, as well as the information as how to get the additional information from Cameron Foundation, okay? Thank you guys. Y'all have a great day.
Thank you. You have a great week.
Bye.
Bye. Ebo.